Hi, where is the... Thank you. It's good to have the pointer. Mr. President, ministers, fellow participants and fellow, participants in this conference. It's an honor to be here today. Listening to the speakers before me, I realized that we are all thinking in pretty similar terms, and I'm quite encouraged by hearing what I heard. So I was asked to share my thoughts on health and mental well-being in the Arctic, and as I started preparing for the lecture, repeatedly, an old patient of mine came up in my mind. And I think the reason that person came to mind repeatedly is the challenges that she was facing, which in many ways are typical for the challenges people in the Arctic face. So I would like to tell you her story briefly to begin with. More than 20 years ago, I was working first as a general doctor in a rural hospital in northern Iceland, and then as a junior doctor at the psychiatric department in Landspi in Reykjavik. In both roles, I came across a middle-aged lady that I remember quite well. Let's see if this works. Yeah. She was a farmer in a remote valley. She lived alone on a farm in a valley where once there had been a number of farms, but now she was the only farmer left in the valley. She was a widow. She'd been married, but her husband had died more than 10 years previously. They'd had one child, a son, but a few years before he had, in his late teens, committed suicide while he was away from the farm working. From that day on, around the anniversary of her son's passing, she became depressed and bedbound for 1 or 2 months every year, and in the end always had to be admitted to hospital in Reykjavik, 500 kilometers south. I remember that apart from the sad repetitivity, if you like, or regularity of her admissions, the logistics of getting help to her when she lived 160 kilometers from the nearest town, and then the logistics of bringing her all the way to Reykjavik were quite a challenge. And I remember finding it strange and that there didn't seem to be any way of preventing this happening again and again, of supporting her at home or of mending her problems. Now, the tale of this lady highlights, in my belief, a number of issues that are at least as relevant now as they were 20 years ago, issues that we are struggling with all over the Arctic, although some of the issues are particularly challenging, I believe, in indigenous communities. So this woman suffered from a mental illness, depression, but the underlying reason for her problems was the tragic suicide of a young man. And there is no denying the fact that suicides, especially youth suicides, are a major epidemic in Arctic regions. Now, I use the word epidemic here, both because suicides are so common, and they're in many, but particularly in indigenous communities, but also because this is a relatively recent thing which has grown exponentially. If we look at Greenland until the 1960s, suicides were rare events in traditional communities. And it's not entirely clear what's happened since, and it's certainly not possible to put a finger on 1 or 2 causes, but the transition from traditional societies to modern time have obviously proved very difficult for many communities, and this is known in other parts of the world as well. Now, as early as 1985, Watton was reporting in Canada's north around 60 suicides per 100,000 population per year in indigenous populations, compared to 13.5 in the Canadian population as a whole, so there's more than a 4-fold higher risk in those communities. And there a rate of 295 per 100,000 in 15 to 24-year-old men was reported in some areas. Although huge variations exist, the overall picture has not really improved much. In the 1990s, suicide rates of 500 suicides per 100,000 per year were reported by Bjerregaard in parts of Greenland. What can explain this? Now, the reasons mentioned in the literature are the ones you know about: poverty, childhood separation and loss, accessibility to firearms, alcohol abuse and dependence, a history of personal and familial health problems, and both past sexual and physical abuse. But behind all of this, there is this story of people who have, within a very brief period, 50 years or less, lost a traditional way of living. It's a story of disrupted communities, of families falling apart, and of young generations struggling to find purpose. It is also a story of unemployment, particularly youth unemployment, which is toxic for any community. And looking into individual cases, we're faced with a massive mountain of undiagnosed, untreated, and unmet social and mental health needs. Wherever we look, we see the same pattern, although reports differ somewhat. But large pockets in Greenland, in Canada, in Alaska, in Siberia, all the same. The same high, although variable suicide rate, the same youthful pattern. And it is a major issue, as you all are aware of. Simple explanations do not suffice. The problem must be dealt with. Now, a second issue that the story I started with brings up is the issue of logistics, for lack of a better word. The challenge of trying to bring support to someone who lives in a remote area far away from professional help. Such a person is less likely to have mental health and social needs noticed, and hence less likely to have those needs met, because nobody knows about them. This is something we see in remoter areas of Iceland, and there is no reason to believe it's any different in other parts of the Arctic. On the contrary. Certain mental health problems, for sure, are less common in rural areas, but other problems are more common, and people in remote areas are far less likely to receive help and support all over the world. Help that could improve their lives and sometimes save them. So how can we as communities address these issues, provide support and help in areas where we are facing great distances and limited resources? Telemedicine is certainly one way. Evidence shows that assessments and therapy sessions delivered via remote telemeetings equipment is as useful as if delivered face-to-face. So there is certainly much help in this, and the technology is becoming easier to use all the time. I wouldn't overemphasize the use of this technology, however. Such sessions are helpful to diagnose and manage well-known mental health problems, but they do not substitute social and mental health support locally. What is truly needed in the long run is to build up mental health expertise. Technology can certainly help, make better use of resources, but it cannot replace good organization and adequate resources, no more than a fax machine would have done put on a desk 30 years ago. So coming back to the story I started with, the lady I told you about before, she had to move away from the farm in the end. The reason wasn't just her mental illness, it was a combination of things, a part of the long-term trend that sees populations move from rural to urban settings. But would we deal differently with her problems today? Well, we'd probably use telecommunications more effectively, Skype or some equivalent, to monitor her better and support her. But apart from that, I'm not sure really that we're much closer to managing the problems now than 20 years ago. It's a major challenge to think towards the future. How can we properly understand the issues and challenges faced by remote communities, build up communication and collaboration, use new technology intellectually and intelligently, both to help clinical staff, but also to bring together widely scattered centers of knowledge all around the Arctic? I'd like to bring up Bo Kunberry's report from 2014 on Nordic Collaboration in Health. It's an excellent and a very intelligent report, and from it the Arctic region as a whole can draw many lessons on how to collaborate on major issues. I don't have time to go through the list of proposals. Its recommendations, some of them are highlighted there. All of them are highly relevant within the Arctic region and as a whole, and I think we should look towards learning from it. Now, this is a photograph showing smiley sticks. It's an initiative staff and patients of mental health services in Iceland started a few years ago. The woman in the middle there, hiding behind the smiley stick, is Ásta Ragnheiður Jóhannesdóttir, then head of parliament. The initiative was about smiling in the face of stigma and adversity and collecting funds to improve conditions for patients on our wards. It was hugely successful, not only in collecting money. No, the main benefits were to open the dialogue and sense of community this work brought to those who were involved was hugely important. And that brings me back towards the end, to the question, how can we start addressing the challenges mental health issues in the Arctic face? One of the biggest problems is being alone with the problem. The individual is often terribly isolated with sadness and loss. So how can we reach out to that person? I think the foundation of that support, as has been mentioned in talks before, the foundation has to be in the local community, even if it's just a tiny village. There, we will need to train people locally, not only health workers, but also people who can act as anchors, rocks in the society, and the way to reach them is through, well, all sorts of different means. Awareness campaigns, etc., in an effort to lift the stigma of mental health problems and addiction, but ways that I, as a health professional, cannot see really or vision are useful as well, because we need to build up resilience and knowledge in the local communities to a far greater extent than currently is done, and use language that is not only the language of health professionals. But on a larger scale, we also need to train far more health professionals, psychiatrists, psychologists, social workers, mental health nurses, all of who can then use health information technology and regular visits to communicate with, train and support local staff. We at the National Hospital in Reykjavik have been willing to accept students for training from Greenland and take seriously our role as an important source of knowledge and professionals in the region. But it's also obvious to me, coming to this Arctic Circle Forum, that strength lies in numbers and in communication. The Arctic region is a vast and very sparsely populated area. It's not just individuals and families that are alone with challenge and stigma. It's also small villages, small towns, and small countries. Addressing these issues on a regional level, leveraging the ideas and resources of the whole Arctic region is needed to tackle these issues. Mental health problems, addiction problems, lack of roles, suicides, and we have no choice but to work together. So thank you very much.